way, in fact, is the opposite of a good thing to do when it comes to this virus or putting sunlight in your body, or am I off there?
I think I can be pretty definitive in saying that's not a good idea.
Jeez.
Please don't do that.
Yeah, and we've had Lysol and many other places come out and say, please don't do that. I'm all for ideas. I'm all for creativity. But I want to ask you, we talk about herd immunity, community immunity. A lot of reports coming out this week. The Santa Clara County one, now New York, saying that infections, I think in New York, maybe up to 14%. I think a lot of people hear that and go, oh, well, everyone's getting everything wrong. We've almost got herd immunity again for everybody. Number one, why do you think these are coming out? And two, we're still a ways away from herd immunity, even if those reports are correct, right?
Yes. So I think what the reports tell us, and again, these are preliminary data that we're getting, so the data still needs to be vetted. What it is showing is that the disease, this virus, was probably spreading in January and February, and there are a lot more people who got it than we identified through testing. And we always knew that we were not testing enough people. Most people are guessing that probably about 10 to 20 times more people got the disease than we identified through testing. Now, what these figures show is that perhaps it's a bit larger than that. But I would point out that, for example, they did the study in Santa Clara County. They estimate, again, it's an estimate, 2 to 4% of people probably already have the disease. When they looked at Los Angeles, about the same range. To get to what we call community immunity or herd immunity, you need around 70 to 80%. So we're a long way from there. So what it shows is that even though we've had some people infected, and many more than we determined through testing, and therefore it means that we have to do a lot more testing to get control over this infection, that we still have a long way to go. And even looking at New York, so we got some data that came out of New York. So you think about what happened in New York City. Over 11,000 people dead, probably even more than that, because New York acknowledges that many people have died who never even got an opportunity to be tested. The death rate is so high. Even in New York, where the disease ran rampant, the hospitals were overrun, the funeral directors couldn't handle all the bodies that were showing up. They had about 20%. Okay, so they're still a long way away. And when we think about it, if we just let this disease run, you take that 20% and say, well, actually, to get to community immunity, we need to get to about 80%, multiply their death rate, the number of deaths they had, by 4. And one could argue that if you actually just let it run, even a higher percentage of people would die, because at that point the hospitals were overrun, and if we just ramped it even more, it'd be even worse. So I think it's a reminder to all of us is that what we're doing now is working. It's saving lives. There was an estimate by an epidemiologist in San Francisco at UCSF that the early orders in the Bay Area probably have saved around 34,000 to 44,000 lives here in the Northern California, the Bay Area. So what we're doing is saving lives. I know it's very hard, and we're certainly nowhere near getting that community immunity. That means that we can just lift the orders and we're not going to have a large outbreak where many people will die.
Dr. Richard Pan with us here on Sports 1140. Doctor, what's the best medical explanation for parceling out the difference from some people getting it and getting to death ultimately, or even a ventilator, compared to others that can be asymptomatic? I mean, what a wide variety that is. How would you explain that medically? Well,
we're still figuring that out. This is the virus that primarily affects the respiratory system, although, as we're learning more about it, seems to affect other parts of the body as well. So one of the symptoms that people are identifying related to this infection is the loss of smell, or what they call anosmia. So basically you have a loss of smell, which, by the way, is part of your nervous system. And so there are some indications that this virus could attack the brain or the nervous system, which is kind of scary. And exactly how severely those symptoms might be and how long they persist is still a bit unknown. There's other parts of the body as well that it affects. So, but the main thing is that what we do know is that in terms of people dying, if you're older or you have a pre-existing condition, heart or lung condition or diabetes, you're at higher risk of death. However, that doesn't mean that if you are perfectly healthy and you're young that you can't die from this, or more importantly, end up in the hospital. So there's still a fairly high hospitalization rate. So even though we oftentimes talk about, well, what the death rate is, we have to think about how many people still end up in the hospital, even if they don't die of this disease, and what that means. So it is very important that we continue to do what we're doing with the physical distancing and staying at home, but we also need to ramp up the testing. We're ramping up what we call contact tracing, and then isolating people who have diseases, the path to finally trying to lift some of the restrictions that we have in place now.
Dr. Richard Pan joining us. Dr. Richard Pan is also a state senator, so he understands the political sides and realities of the situation as well. Doc, without me rambling too much here, the big debate raging on streets and houses and neighbors is when is the right time to go back? You have people that are losing their businesses, losing their jobs, afraid they're going to lose their houses. It's a very real, very understandable conversation. And the argument I keep seeing brought up is, hey, if we want to go to work and we want to risk ourselves, let us go do this. You don't have to go back to work. You don't have to be around me. Let me take the risk, and if I get sick or if I die, that's my choice, but I'm willing to take the gamble, which is relatively small, in order to return to work and continue to support my family. As a physician and as a, for lack of a better term, a politician, what would your response be to somebody presenting that point to you?
Well, first of all, I have to say is that this is a contagious disease. So any decision any one person makes has effect on many other people. So it isn't a decision that you make that solely has consequences for yourself. You're not the only one you're putting at risk when you're out there interacting with other people. You are part of the chain of transmission. What we're trying to do by asking people to stay at home is and also to keep that physical distance of 6 feet away, is to break the chain of transmission. So we don't have the disease going from one person to another person to another person. All right. The second thing I would also point out, though, is that this idea that it's a choice between public health and the economy is actually a false one. When you look at the research, and you look at history, for example, when people looked at what happened in 1918 with the pandemic in the U.S., where many people did die, what they showed is that the cities that started early with a stay-at-home order that persisted in doing that not only had fewer deaths, their economies came back more quickly. And I would point out that it obviously depends on the nature of your job, but for example, a restaurant will not be very successful without customers. And if people are afraid to go to your restaurant and eat, even if your business isn't going to do very well. And we have to understand that the fundamental problem that the economy is facing is that you have a very serious, very deadly disease that's out there that people don't want to risk dying themselves or risking their families. So that's going to decrease the amount of economic activity in itself. And I think people need to recognize that just by, quote, lifting the stay-at-home orders will not bring business back to what was normal. People will still be afraid to go shopping, to go to restaurants, to travel. I don't think a large number of people, if we said we lifted the limits, are now going to be flying on airplanes and going on cruises. I think a lot of people will be going, why would I want to do that? That's dangerous.
So what would be, just based on that answer, Dr. Pan, are you going to monitor, and others I'm sure will monitor, let's say, the state of Georgia for a month to see, they're starting to reopen some things. Will you be looking at some case studies and numbers there over the next 3, 4, 5 weeks?
Well, certainly we can monitor what happens in some of the states like Georgia. You would expect, usually there's about 2-week lag before when you start seeing the impact of the disease spreading again. We certainly have already seen this in other parts of the world. So let's just take Singapore, which actually very successfully was able to handle the disease until recently because they have a lot of migrants who work there who are in crowded living conditions, and basically they've had to shut down a lot of things in Singapore. So we already have other examples around the world. I guess if some people want to try it out here in the United States, we kind of know what will probably happen. So if Georgia does try to open up, we'll see what happens in a couple of weeks. But I want to just go back and say that what we need to do is be able to give people confidence. So a lot of our economy is driven by consumer confidence. People have confidence that we have control over this disease. And so that involves being able to ramp up our testing to the point where we can identify people who have the disease, recognizing that many people who are infected don't actually display symptoms. So we have to be able to do identification, contact tracing, which is tracing all the contacts of people who are positive, and that will help us actually identify more people who might be asymptomatic or not have symptoms and then be infected, and then, of course, isolate people who have proven to be positive. And that will need to take place after we start seeing a downward trend in the number of cases. So we haven't seen that yet in California. We've been very successful in limiting the total number, but it's still creeping up. But once we get over the hump, we see a downward trend for approximately 2 weeks. We also simultaneously need to ramp up our testing, which we are working on very hard. So we can right now do about, I think, 15,000 tests a day. Our goal is to get up to around 80,000 a day, which would allow us to have the volume of testing to be able to do this. And then we have to do contact tracing, which is anytime someone's positive, find out all the people they've been in contact with who might get the disease, identify them, test them, all right, and then anyone who's positive, isolate those people. And that will allow then the rest of us to be able to hopefully engage in more comfortably in a way that allows us to have more activity going on, including hopefully by the fall. I said hopefully, don't know, that we can get kids, let's say, back to school starting with the new school year.
State Senator and, of course, Dr. Richard Pan joining us on The Drive, answering your questions. And you talk about psychology. I think that's so important. You're right. You're going to have businesses opening up and paying for staff and paying for food if you're a restaurant, but looking around and going, well, where are my customers? It was already tough to have a small business. And when you talk about the psychology, it sounds like the major factors, of course, a vaccine is number one. That's blue sky, and we're a ways away from that. Another would, of course, be herd immunity. That would be fantastic. But it seems like the most realistically quick one would be understanding, if you've had the disease, had the virus, how much immunity you have built up for how long. And from what I read, Doc, it sounds like we're still not zeroed in on that. So I'll just ask you straight out. If I was coming to you and saying, I have had 5 straight days of no Tylenol, no fever, and I was a confirmed coronavirus patient, are we any closer to be able to tell me, yes, you can go back out, yes, you're immune, and you're going to be immune for XYZ days, weeks, months?
We don't know the answer to that question yet. So again, this virus has been around probably around 5 months, 5 to 6 months. We unfortunately do not have the answer to that question yet. It's a difficult question to answer, and in many ways, part of the reason it's difficult to answer is how long your immunity lasts means that we have to wait that long to find out. So that's what takes time to figure out. Unfortunately, we don't have the answer to that question. That's an extremely important question to be able to answer, because if we don't know how long people are immune for after they get the disease. We don't know if people, even if they've got exposed and got infected, are they going to be able to be reinfected, and at what point in time? So that's an extremely important question. There's also been some debate about, for example, if you got the disease and you were asymptomatic, you didn't have any symptoms, did you mount, how much of an immune response did you mount that will provide protection versus someone who got a more severe form of the disease? So there's a lot of questions out there, and that's also why the serology testing that we're doing is, in terms of what we can interpret the results to mean. So we started off this today talking about the studies in Santa Clara and Los Angeles, and we talked about community immunity levels or herd immunity levels. But yet what I can't tell you is that, yes, we did a serology test. We know 2 to 4%, or we estimate 2 to 4% of Santa Clara County, roughly the same in Los Angeles County, had the disease. But I can't tell you that all those people are definitely immune, because we don't know yet. We don't know just having antibodies alone is enough to provide immunity, because you can have, what we need to actually be able to try and measure is what we call the neutralizing antibodies, the antibodies that would prevent the virus from being able to continue to spread. And we haven't figured out which antibodies are those antibodies.
Dr. Pan, I just want to follow up real quick. I've kind of avoided asking you this for a few weeks because I just don't even want to verbalize it, but you see, especially on social media, if there's a lot of mistrust, doctors, governments, a lot of misinformation out there, modeling that's been wrong, mortality rates that are lower than originally thought, and the common theme to those that are questioning, which I think is perfectly healthy, is the government overplaying this? Is this really? We're going to look back and look at this, and this was the little worse than the flu, etc. Anyways, you know that. Here's what my concern is. In the back of my head, I can't help but think, Doc, if we find out that there is little to no immunity, if you can get reinfected, let's say the mortality rate is still, 0.5%, whatever. In your mind, scientifically, is it possible that in order to truly get over this, the only way is going to be either herd immunity or a vaccination, which could still be 1.5 years away? Humans might just be toxic to each other, and we may be looking at a situation where this thing's going to have to run its course through the population. We're going to have to lose what we lose until we achieve that herd immunity or vaccine, whichever comes first. That seems to me like a worst-case scenario, but scientifically, do you see that as a possibility?
So first of all, let me just say is that this is a new virus. We first identified it 5 or 6 months ago. In many ways, thanks to developments in science, we've actually been able to learn a lot more about this disease in this short amount of time than we've been able to learn about other diseases in history. So you think about how long it took to figure out HIV was the cause of AIDS, how long it took to address polio, and then finally invent a vaccine that let families not have to worry about their kids being paralyzed every summer, right? We've actually made rapid progress. What you've described is a worst-case scenario. I won't say that it's impossible, but what we are doing is we are learning things about this virus every week. Some people would say every day. And as we are slowing the spread of this virus and we are learning more about it, we are going to be able to develop more effective strategies in trying to deal with this infection without having to sacrifice thousands, some people even hundreds of thousands of lives. So this is a huge challenge for our society. It's a huge challenge for our community. We need to continue to work hard to try to mitigate its impact, but also figure out what are the solutions we can get to that continue to save people's lives in all dimensions. So both in terms of people being able to live in reality, but also recognizing that we have an economy, and kids need to learn, get back to school eventually. People need to be able to live their lives, and we are working toward that.
Well, Dr. Pan, we say it every week, but we really do have to thank you for taking out time for us every Friday. We appreciate that. We know our listeners do as well. Thank you so much. Have a great weekend, and we look forward to talking to you again next Friday.
Okay, thank you so much for having me on again.